A renowned bariatric and general surgeon from Las Vegas talks about his education and experience. He specializes in advanced bariatric laparoscopic surgeries, complicated hernias, and gallbladders. This is a 6-part video series. In this video, he explains the steps in sleeve gastrectomy.
I'm a bariatric and general surgeon. I completed a fellowship at USC in advanced laparoscopic surgery. We addressed a lot of complicated general surgery issues such as complicated hernias and also complicated gallbladder disease. Although the majority of my practice is bariatrics, I still do these procedures. The steps for a sleeve, actually the most important part of any operation begins way before you get to the operating room. Most important part is to have a surgeon who's experienced and to have a patient who's very comfortable with that doctor. That's the most important thing. You have to be comfortable with your doctor because that allows somebody to relax and allows somebody to have a safe procedure. If you're not comfortable, if you're nervous, if you're anxious, you're going to have more problems after surgery. So that's probably the most important thing. That's one we concentrate on a lot. I see every patient every time at every visit in my office, and part of that is making people comfortable with me and me with them. So, and then when they get to the hospital or to the surgery center, we start out by giving them pain medicine. Even before we've gone to surgery, I give them pain medicine. It relaxes people, it makes them comfortable. Again, it enables us to operate safely. So those are all important steps for any surgery. For the gastric sleeve, what we're doing is we're freeing up the stomach from its attachments. It's attached to the spleen up on the top, it's attached to the large intestine on the bottom, and we free up those attachments, and we do that by coming in, starting at the top of the stomach and taking the stomach off of the diaphragm. We actually remove it from the diaphragm so that it's free. We come below on the sleeve, we open up an area below, and then we take our stapler and come back up to that open area from above and divide it. Once we've freed all the attachments, once the stomach has been stapled off, we now have a section of stomach that can be taken out, and believe it or not, that is taken out from a hole about that big very easily and quickly and safely in the operating room. We take that out. The next important steps for this operation are to check what you've done. So we test the connections, test all the stapling, and we do that by clamping things from below and having an anesthesiologist inject blue dye. The sleeve will actually distend, it'll blow up real tight, and if there's going to be any leaks, you'll see it right then and there. We do that pressure test and we know it's good. The last thing we want to do is make sure at the top where the opening is through the diaphragm is not too wide. If that opening is too wide, people tend to have problems with reflux. So what I do in my operations is I actually clear up that opening and put an extra suture in there to help reinforce that area so that reflux is kept at a minimum after the surgery. So we put an extra stitch there typically with the sleeve to prevent reflux.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote.